This week, lawmakers discussing whether the state should apply for a federal grant that supporters say could expand mental health and addiction treatment services.
Taylor Howard shows the talks at the state capitol and why they say it could make a difference.
Presenters told lawmakers Arkansas has roughly 2,500 people experiencing homelessness statewide, including about 1,300 living unsheltered. They argued many of those individuals are also struggling with untreated mental illness or substance abuse.
We know that there are a lack of public state hospital beds for folks that are seriously mentally ill. We also know that there are challenges with respect to civil commitment issues.
The panel included Fort Smith Police Chief Danny Baker, who works closely with homeless service providers. He spoke about some of the challenges law enforcement sees in the community.
I've had conversations within the last year about concerns of increased number of sex offenders within the homeless population. So we're very much aware of that and do our very best to make sure that we keep track of those folks.
One recommendation would have the state apply for a federal planning grant to expand certified community behavioral health clinics. Supporters say those clinics provide mental health care, addiction treatment, crisis response, and recovery services. One provider already using the model in western Arkansas says those results speak for themselves.
And our outcomes have really been tremendous. So a 79% reduction in homelessness in these people, 70% reduction in time spent in hospitals, 58% reduction in ER visits, and 61% of time of persons spent in treatment facilities. Those are all very high costs otherwise spend, and 84% less time in correctional facilities and arrests. So very effective.
While lawmakers discussed possible solutions at the Capitol, we wanted to see what those challenges looked like on the ground.
Are you all right, Cindy? Yeah. Okay, good.
At Hope Campus in Fort Smith, where Program Director Kristen Conley says many people who come through their doors are facing mental health or substance abuse challenges, but also a deep sense of hopelessness.
They just feel hopeless. It's not that they don't have a way, they just feel like there's not a way.
She says the people experiencing homelessness are more than statistics or policy debates.
If they could treat each piece of paper as if it's an actual human being, every rule as if it's a human being, and really think about what the ripple effect of that is going to be, I think that we may have more success.